If your doctor has mentioned knee replacement surgery and just the thought of it terrifies you, here's how to get some relief while you figure out your options. Let's talk about what's happening inside your knee, because once you understand it, everything else makes a lot more sense. Your knee is the largest joint in your body, and one of the hardest working. Every step you take puts pressure on it, and over time, that adds up. When your knee is healthy, there's a layer of cartilage that cushions the bones and lets them glide smoothly against each other. But unfortunately, cartilage has almost no blood supply, so unlike most tissues in your body, it has very limited ability to repair itself, and once it starts wearing down, your body can't rebuild it. That's when things start to accelerate. Bones start scraping against bone, inflammation builds up, and pain can start becoming constant. Doctors classify knee osteoarthritis in 4 stages. In the early stages, you might not even notice anything, maybe some stiffness after sitting too long, a little ache that comes and goes. By stage 2, the pain becomes more noticeable. You feel it after walking, going downstairs, or getting out of a chair. Stage 3 is where most people really start struggling. The cartilage is significantly worn. Daily activities become painful. The knee might swell, stiffen, or even begin to make grinding noises. And stage 4? That's bone on bone, with little to no cartilage left, constant pain. And this is usually when surgery becomes part of the conversation. The frustrating part is, this doesn't happen overnight. It takes years, and by the time most people realize how bad it's gotten, they're already deep into it. If you've been dealing with knee pain for a while, you've probably tried some combination of painkillers, bulky knee braces, and oftentimes cortisone shots. They all have their place, but they're either temporary, uncomfortable, or come with their own issues. So you end up stuck in a cycle of temporary relief, then back to square one. Meanwhile, the underlying problem keeps getting worse. And if surgery is in the discussion, it's important to completely understand the risks before going under the knife. The average wait time for a knee replacement can be months. Months of just dealing with it, not sleeping because every position hurts, avoiding activities you used to love, feeling like you're losing yourself a little bit at a time. And even after surgery, recovery isn't easy. The first 2 weeks are often the hardest. Significant pain, swelling, limited mobility. About 60% of patients experience moderate to severe pain in that initial period. Most people need 3 to 6 months to really feel like themselves again. Some take up to a year. So, whether you're trying to avoid surgery, waiting for surgery, or recovering from surgery, you need something to help you manage. Something that actually works. Here's where it gets interesting. Compression therapy has become an increasingly popular topic for knee osteoarthritis, and the results are encouraging. One clinical study found that wearing a knee sleeve significantly reduced pain in people with knee osteoarthritis, as well as showing users able to get up and move with much greater ease and far less grinding in the joint. How does something so simple help? Researchers believe it comes down to 3 things. Number 1, patellar tracking. The sleeve provides a gentle hug around your kneecap, keeping the joint components more securely in place. This minimizes the side-to-side shifting that causes grinding and popping when you move. Number 2, enhanced proprioception. That's your body's ability to sense where your joint is in space. The gentle pressure helps your nervous system better track your knee's position, which improves stability and reduces pain. Number 3, less swelling and stiffness. Graduated compression increases blood flow, which pushes out toxic fluid and brings in fresh oxygen and nutrients to help your body heal. Wearing the sleeve while you move helps reduce grinding and popping throughout the day. But one of the biggest breakthroughs has been focused on timing and supporting the knee overnight. Compression therapy while you sleep is showing some incredible results.
Most people dealing with knee pain after 50 assume it's just part of getting older, or a natural progression of wear and tear. But in reality, it's often linked to poor circulation and inflammation building up around that joint. When your knee gets inflamed, whether from old injuries, arthritis, or overuse, your body sends fluid to protect the area. And for most people over 50, that fluid doesn't always drain back out, causing pressure to build, circulation to slow, and your knee never gets the oxygen and nutrients it needs to recover. That's why rest alone doesn't fix it, and why most treatments only work temporarily. Overnight compression therapy is one of the few treatments able to gently encourage that trapped fluid to drain while you sleep. This helps to reduce pressure and restore circulation, giving your body a chance to heal naturally.
But here's the problem. Not all compression sleeves are the same. Most are made from synthetic materials that trap heat and moisture. After 30 minutes, they become uncomfortable. You take them off. And if you're not wearing them consistently, they can't help you. That's why we created One Compress, the first sleeve combining bamboo fabric with true graduated compression. Bamboo is naturally softer and more breathable than synthetic materials. It wicks moisture so you can wear it all day without discomfort. And it regulates temperature so it won't overheat your knee. The result is a sleeve comfortable enough to wear constantly and specifically overnight, to finally tap into the natural window when your body does most of its healing while you sleep. For people facing knee surgery, this is where the One Compress bamboo sleeve really shines. See, many orthopedic specialists recommend compression sleeves as a pre- and post-surgery option. Before surgery, reducing swelling and managing pain can help you go into the procedure in better shape, as well as make the waiting period more bearable. After surgery, compression helps with swelling, supports blood circulation, and can make the recovery process smoother. We hear from customers from all over the US and love to hear feedback like this.
I'm loving this. This is so soft.
I've slept through the night with no pain.
I absolutely love them.
Honestly, my knees feel a lot better.
It makes my leg feel so much better after having knee surgery done.
3 nights pain-free sleep.
And I have not been awakened by aching knees ever since.
Every person is different, but when you hear the same story over and over again, it's hard to ignore. Over 250,000 people have tried One Compress. Most fall into one of 3 situations. They're waiting for surgery and need something to help them get through until then. They're recovering from surgery and want to support their rehab, or they're just looking for some relief and a natural way to support their knee. Different situations, same goal. Less pain, more good days, and getting back to the life they had before their knee started holding them back. Some people experience significant relief. Others only notice a modest improvement. That's why we offer a 60-day trial, so you have 2 full months to try it and see if it works for you. If you don't notice a difference to your comfort or recovery, just send them back. Click the link below or the button on your screen. You'll go straight to our website, where you can choose your size and the bundle that works for you. One thing worth knowing: One Compress sleeves are only available through our official website. You won't find them on Amazon or in stores. We've seen too many cheap imitations that look similar but use cheap materials that fall apart after a few wears. If it's not from onecompress.com, it's not the real thing. If you need help with sizing or have any questions, contact our support team. They're happy to help. Look, there's no easy answer for knee pain. The pain isn't going to magically disappear, but you don't have to just suffer through it either. A good compression sleeve won't solve everything, but for many people, it can make the day-to-day more bearable. Whether you're waiting for surgery, recovering from surgery, or just hoping for some relief, it might be worth a try. Click the link below and get yours before we sell out again.